Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about neurological symptoms in many COVID long haulers. I'm here today with Dr. Christine Boutwell, Interim Medical Director of St. Luke's Marion Block Neuroscience Institute. Thank you so much for joining us.
Thanks, Lindsay. I'm happy to be here today.
A new study published late last month found 85% of COVID long haulers who had mild COVID experience ongoing and sometimes debilitating neurological symptoms more than 6 weeks later. Dr. Boutwell, can you explain what kind of neurological symptoms these COVID long haulers are dealing with and what you're seeing here?
Yes, Lindsay, this article was interesting in looking at prospectively COVID patients that have long haul problems with very mild forms of their COVID, mild symptoms of COVID. What we're seeing here is a lot of patients are complaining of cognitive issues, difficulty thinking. It's been described as brain fog, maybe fatigue, maybe different processing issues from a cognitive standpoint, numbness, tingling. There's been loss of smell and taste that's persisted for many weeks or even months following some COVID infections.
And why does the virus cause these symptoms weeks to months later, even in these mild cases?
Well, that's a really good question that we don't have the answer to. It's not really known why patients are experiencing these symptoms. There's been several theories on whether there is direct invasion of the virus that gets into the nervous system. We know that perhaps it invades the lining of blood vessel wall and causes some symptoms we see in more severe COVID patients. It may be the inflammatory response that the virus itself is causing, releasing many neurotransmitters that are causing these symptoms. We do know that a large percentage of patients, no matter whether their COVID is severe or mild, have been experiencing some symptoms.
Now, should long haulers expect these symptoms to clear up over time?
We think so. In this study, their symptoms were improving, but still fairly prevalent. When you look at retrospective long haul post-COVID-19 affecting different organ systems, and you focus neurologically, a lot of patients are still having the symptoms. We hope that they will get better over time, but we really just don't know yet.
So is there anything people can do to help manage their symptoms?
So I think definitely keeping track of your symptoms, maybe keeping a diary or a journal would be helpful, and definitely seeking care when you're having persistent symptoms that are bothersome in your normal life, because we don't want to exclude or miss the opportunity of another problem causing, and there may be some treatments that we can use to help with some of these symptoms.
So when should someone go see their doctor for some of these symptoms?
I would definitely have a low threshold for going to see your doctor if you're experiencing any difficulties following a COVID-19 infection. Again, I would not want to miss another diagnosis or miss the opportunity to treat something that needs to be treated. There may not be treatments for your symptoms, and we may just have to monitor over time, but I would have a very low threshold for going to be seen if anything is bothersome.
Aside from these more common symptoms, what other neurological issues or complications can the virus cause?
So we have seen a fair amount of neurological complications, particularly in our hospitalized patients. We've seen things such as large artery strokes. We've seen Guillain-Barré, which is a ascending paralysis. We've seen some long-term nerve and muscle problems with weakness, partly in effect for patients being so critically ill. We've seen some cognitive impairment and delirium and some issues with thinking clearly.
Well, is there anything else you'd like to add or end on today?
I would just really like to encourage patients to seek help with their healthcare team if they're experiencing any problems, no matter if their COVID symptoms were mild and they did not have to go to the hospital, or if they were severe. I would not want to discount anything, and I think we have so much more to learn about COVID and the long-term effects, and so I would seek help.
Okay, well, thank you again, Dr. Boutwell, for joining us.
Thanks, Lindsay.
If you'd like to find out more about St. Luke's Marion Block Neuroscience Institute and the multidisciplinary team of neuroscience specialists, visit stlukeskc.org/neuro. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.